Esteemed members of the society, welcome to today's session. Good evening, everyone. If you can hear me, please type on the chat. Let us know where you're joining us from. Good evening, Dr. David. Good evening, Dr. Winfred. Vosta, good evening. Kindly let us know where you're joining us from. Dr. Fred Githinji, karibu from Kitengela. Dr. Mudune from Laikipia County, karibu. Dr. Samson Juma from Bomet, karibu sana. Dr. Sylvia from Embu, karibu. Dr. Wairimu Mbogo, karibu sana from Kiambu. Dr. Karanja from Kisii University, karibu. Dr. Daniel Joe from Kisii, karibu. Dr. Joseph Kahugu from Nairobi, karibu. Dr. Polycarp from Gong, Karibu. So I see that you can all hear me loud and clear, and we've just hit over 300 members. Thank you so much for joining. So welcome to today's session. This session is being supported by inSupply Health, and the topic for today is quality family planning services by pharmacists, building customer relationships. And in this session, we have several speakers who will be speaking to us on different topics. First, I'll take you through the ground rules for this session. So first, it's to appreciate you for joining us for this session. And all participants are muted for the entire course of this session. So if you have any questions, kindly use the Q&A tab at the bottom of your window. And the questions are going to be addressed by the presenters at the end of the session. For PSK members, if you have not subscribed on the PPB portal, please do so. Your CPDs will be shared later on. And then for KPA members, also please make sure you subscribe on the portal. So this session is also being recorded and will be made available in the PSK YouTube page later on. So for this session, we have different activities that will be happening. First of all, we're going to have a Menti session, and that is Dr. Johnson Anyona who will be taking us through that. Then we'll have a project overview that will be run by Dr. Wanjiru Munene from inSupply. We'll also have a session on customer relationship that will be run by Dr. Michael Mungoma and Dr. Anita Achieng. Thereafter, we'll have a session with Kasha, and this will be run by Dr. Georgina Kamene. And then we'll have a Menti session run again by Dr. Johnson Anyona. And finally, we'll have the Q&A sessions and closing remarks from PSK. So at this juncture, I'd like to welcome Dr. Johnson Anyona to run the Menti session. Karibu, Dr. Johnson Anyona.
Thank you very much, Hezron. Good evening, colleagues. I hope everyone is well. In line with the topic for today, we're just going to do a bit of a knowledge check to assess our level of understanding before we begin the main session. So we'll be doing it on Menti. So if you have your phone, your laptop, whichever device you're accessing this webinar through, go to www.menti.com, and I'll be sharing my screen shortly to display the code. Hezron, please confirm that you can see my screen. My screen is visible.
Yes, we can see.
Good. At the top, you'll see the code for the Menti. So you'll go to www.menti.com, and you can enter the code that is at the top. Please, Hezron, you can paste the code as well on the chat. Once you're in, you will see a love button. Press it so that we can register your presence and take stock of the people who've joined the quiz. So if you're just joining, we are doing a knowledge check before we go into the webinar on menti.com. That is www.menti.com. And the code is at the top of the screen. Enter the code. Once you're in, you'll see a love button. Please press it so that we can register your presence. Okay, we are about to get to our first question. Remember, we are doing a pre-test just to assess our knowledge check before the webinar. And we are doing it on menti.com. The code is at the top of the screen. Once you go to menti.com, enter the code, and you will be able to answer the questions for this knowledge check. So we are about to start in the next 10 seconds. So get ready to answer the questions. Remember, the topic for today is quality family planning services by pharmacists, and the focus is on building customer relationships. Okay, so let's begin the first question. Question 1. What might make a client prefer one pharmacy over another? We have nearly a pharmacy in every corner. What might make a client prefer one pharmacy over another? So we have a lot of responses coming in. Customer service, good communication, customer care.
On which side? What can you see in front of you?
Privacy and professionalism. Affordability, affordable commodity. Good customer service, confidentiality, the display, trust, friendly service, product diversity, knowledgeability of the caregiver, poor service. Okay, that's an interesting one. Cost of commodities, so many, stock status, good communication and confidentiality. Thank you very much for answering that question. Let's go to the next one. So the next question is, the following are potential benefits to a pharmacist of establishing relationships with clients, except Okay, thank you for your responses. Looks like majority have selected discounts and offers. Let's go to the next question. Which of the following is not a tactic to building rapport with customers? Which of the following is not a tactic to building rapport with customers? Thank you for your responses. Majority have selected being aggressive. Okay, let's go to the next one. The following are examples of self-care products for women, except the following are examples of self-care products for women, except okay, thank you very much. I think that is the last question. I see people are conflicted with this one, but hopefully by the end of the webinar, we'll be able to get clarity on some of the questions you've seen in this pretest, and especially on the concept of self-care. Thank you. Back to you, Hezron.
All right, thank you so much, Dr. Johnson, for taking us through that Menti. At this point, I'd like to welcome Dr. Wanjiru Munene, who will be taking us through the project overview. Dr. Wanjiru, if you can hear me.
Hi, Hezron. Good evening. Good evening, Hezron. I can hear you.
Good evening, welcome.
Great, thank you. So thanks so much, Johnson. Thanks so much, Hezron. I'll give just a quick overview of the proud sponsors of today's webinar, inSupply Health. Also just speaking about the project that specifically is focused on the FP topic, which is our topic of today. So my name is Wanjiru Munene. I'm a senior advisor at inSupply Health. My responsibilities are around market development and partnership, but over and above that, we support in this particular market test project to increase FP access through pharmacies, through retail pharmacies. So inSupply Health's main mission is co-creating innovations for health. And this is well demonstrated in what we're currently trying to do with market test, as you have seen and heard. I believe many of you, this is not your first touch point with our webinars. So inSupply Health, for those who have not heard of us before, is an East African health advisory firm that has offices in Nairobi and in Dar es Salaam. We mainly focus on designing people-centered and scalable supply chains, and we focus on optimizing data visibility and data use, as well as looking at supply chain workforce development, so engaging with different stakeholders and partners, and continuous performance improvement focused again on supply chain. So we operate as a social enterprise, and our main aim is sustainability, but at the same time, achieving the social mission. inSupply Health works across both public and private sector. So in public sector, we are looking at government facilities, government engagement around fostering data visibility and analytics as a foundation for data use in supply chain. We also focus on embedding a data use and performance monitoring management culture within government and public facilities, enhancing supply chain skills, competencies, and capacities across various cadres, pharmacists, and pharmaceutical technologists, as well as nurses and other relevant personnel that handle commodity in the public sector. We also provide consulting services for specific supply chain areas. So this is just a quick snapshot. There's much more we do, and we also co-create solutions together with our partners. On the private sector, which is our main focus today, because we are working with retail pharmacies and community pharmacies, we facilitate market understanding, and we support partners and organizations to navigate market entry for innovators. We also facilitate new product introduction into the market, as well as mining and analyzing accessible data to develop valuable and insights that can be actioned for organizations and partners. So Market Test is essentially a project. It's an implementation research product, and it's a proud sponsor of today's webinar and the series of webinars that we're going to have in the year. And our focus is strengthening and increasing access to family planning through retail pharmacies in Kenya. The main goal of Market Test is to, So the main goal of Market Test is to, we have three main objectives. Is to increase the number of women accessing quality family planning products and services at pharmacies, document the value proposition for pharmacists to offer DMPAC for self-injection and other self-care products to customers, as well as expand the network of retail pharmacies who would implement viable business model while offering quality counseling, training, and family planning products, including self-injectables, which is a DMPAC current focus for our series of webinars. We would also like that the pharmacies focus on a larger basket of self-care products as we aim to expand access to women and give them dignified services at retail pharmacy offering. That gives a brief introduction of Market Test. And our current focus and topic for today would be looking at how to make sure that retail pharmacies are running viable business models, while at the same time offering access to FP and expanding FP services to women. Hand it back to Hezron. Thank you.
All right, thank you so much for that project overview, Dr. Wanjiru Munene. So at this point, we're now going to dive into another session that will be run by Dr. Michael Mungoma and Dr. Anita Ochieng. So Dr. Michael, confirm if you can hear me.
Yes, I can hear you.
I can hear you well.
All right, let me just share the slides.
I'll do the sharing. Thank you.
Oh, okay, sawa sawa.
Yeah, I'll do the sharing for the beginning part, and then you can share for Anita as she starts. Yeah.
Okay, that's okay.
Yeah.
Okay, so good evening, everyone, and welcome to another webinar session. This is part of the many webinars that we have as the Pharmaceutical Society of Kenya to empower pharmacists through continuous medical education. And I'm very happy again to be part of these family planning education sessions. Today, we are going to talk about quality family planning services by pharmacists, building customer relationships. I'll be doing this session together with Dr. Nita Achieng, who is a young pharmacist and also trained in providing quality family planning services in community pharmacies as part of inclusion and empowering young pharmacists who have skills to share. This session, we are going to try and achieve the following. Discuss how to build strong customer relationship, create products and services to customers, develop a customer-focused marketing plan, demonstrate active listening skills, and introducing the TMA concept. So Dr. Anita is going to take us through the first part of this number of slides, and then I'll come in to complete. So Dr. Anita, kindly take us. Thank you.
Hello, guys. Good evening. I hope you're all well. So I'll be taking you through this session about customer relations in regards to family planning. So the most important thing when it comes to pharmacy, being that it's a business, in as much as we're trying to help people. So the first question is, what's the most important thing pharmacists need to do to make money? Kindly, if there's anyone, I encourage all of you to type your answers on the chat box. What's the most important thing pharmacists need to do to make money? So I'm going to give you 2 minutes to type your answers, and then we can engage on this. Feel free to type any answer. Okay, so what's the answer to the question, what's the most important thing pharmacists need to do to make money? You need to have a well-stocked pharmacy. Thank you for answering. You need to have goods that are priced well. You need to have good customer service. The most important thing is good customer service. If a client comes and doesn't find, for example, a certain medication, you need to organize for them to get that specific medication, especially if it's not something, maybe your stomach, your pharmacy, or what you stock. If it's something different from what you normally stock, then you can always find a way to get it for the customer. So that is amazing service. Also quality of products, like cleanliness, make sure the shelves are clean. When the customer walks in, they're appealed by everything they see on the shelf, tidiness, the stock of the products, things that they normally wouldn't find anywhere else. Thank you so much for answering, guys. Thank you so much for answering. Also, good communication skills. The way you explain to a customer, assuming the customer has an X or Y issue, why they have high blood pressure, or why their contraceptive isn't working, or why they should use this or that. That's good customer service. And the customer is 100% more likely to come back for service again. What makes someone a good customer for a pharmacy? A good customer in this case is somebody perhaps who asks questions. Would anyone have any other answers to this? What makes somebody a good customer for a pharmacy? When a client comes in and walks in, what makes you see that this is a good customer? Somebody says somebody who doesn't bargain. That's good. Consistency, yes. If a client is consistent, you definitely know you have good service. Thank you, Nicholas. Thank you, Redemptor. Listens and understands their needs, yes. Somebody who explains, they don't just give you vague explanation on how their stomach is aching. Yes. Positive feedback, 100%. Thank you so much, guys, for your feedbacks. So in this session, we are going to talk about why the customer relations between a pharmacy and the client and why you need to maintain it. So how do clients see pharmacies? Mostly people see pharmacies as a place where they can get a solution for their needs. Every day, not everybody wakes up feeling normal, a headache, a stomach ache. There's something that's always happening to somebody. So when they see a pharmacy, they see a place that has a solution for them. And we need to create solutions for these people. It's not just a matter of it being a business where you're making money, which at the end of the day, that's the goal. But the client needs to also feel the impact of them giving you their money for their needs. So you also have to give very good service. How do you think customers see more of a difference between pharmacies? What makes them prefer one over another? The same things we answered in the previous question, the previous slide. So if your pharmacy is well stocked, they prefer to go to one pharmacy over another. If your customer service is good, they prefer to go to this pharmacy over the other. If you have good explanation, if you follow up, especially following up, I feel like most pharmacies, nobody follows up on their clients. You can give them medication to treat whatever the situation is, or you can give a contraceptive and nobody cares to follow up how the contraceptive is taking the client. Nobody cares to know if their bleeding has become irregular. Are they continuously taking their contraceptives? Nobody cares to call why they've not bought their next purchase of their contraceptive for the next month, which is very important. So these are the things that make a client prefer one pharmacy over the other, because you're then in this way, you're creating a relationship between you and the client, which is very important. How many options does the typical client have for choosing a pharmacy? Same thing that we answered. So the options is well-stocked pharmacy, right information, positive feedback, interaction, how you listen and understand their needs. If your pharmacy is well-stocked, wide range of drugs, also giving them options, like if their budget doesn't fit X, then they can also get Y, yeah? Also writing down their prescriptions. Don't just assume that because you've given Panadol, everybody knows how to take. You don't do that. So also that, because then they prefer to go to another pharmacy where somebody explains bit by bit, because not everyone has a good understanding of all this information. Okay, I hope you're on the same page. So we can go on to the next slide. Differentiating our businesses. So customers have choices of pharmacies, which is common. So they prefer, so what makes a pharmacy, what makes a client choose a pharmacy that is in town on their way home and prefer to go all the way to Thika or Juja and buy medication right outside their apartments? Or what's the difference between them going downstairs, buying medication in that pharmacy that's outside their estate and waiting the next morning to go to town and get medication from there? I believe we have the answers to this question. Some things are like prices, some things are customer service. So you also need to learn to maintain your customers in this way. You have to find a way that they don't have to go all this way and pass through all these pharmacies and go to another pharmacy, yet you have whatever they need. Yeah. So need to stand out from competition to build business. So to become a community preferred pharmacy, I believe in Nairobi especially, you can't walk past 5 apartment buildings and 3 out of those 5 don't have a pharmacy. So you need to know how you're going to attract all these clients to your pharmacy, and not go to pharmacy X and go to pharmacy Y, but go to your pharmacy. Yeah. So thank you, Dravi, for replying. Customer service, ready accessibility and affordability and affordable prices. Exactly. So these are the factors that help. So a customer will come once, you can sell something to them at an extra price. For example, P2, you can sell it at 250 when there's somebody selling it at 150. So you should also know how to work within your margins so that you also don't lose your customers. Yeah. Next slide. So what will make you become the more preferred family service provider? Number one, training. You need to know what you're telling the client. A client doesn't have to come to you and then they're telling you, sasa nichukue gani, which one should I choose kati ya hii na hii? Alafu, you as the pharmacist, you're like, yoyote tu yenye unajisikia. You can't answer a client like that. You need to give them information bit by bit. This is the pros of using a COC. These are the cons of using a COC. This is what you should expect when using a COC. This is what you should expect when using DMPIM, DMPSC. These are the cons, these are the pros. They need to have the information at their table. Then from there, they can be able to choose. But you're not in any way going to let a client, you give them these options without explaining to them. And then you're like, chukua tu yenye unadhani ni mzuri. That is not fair to the customer. That customer will probably never come back again, because if they find somebody who will give them better information, then you've lost a customer. And something like COCs that is a monthly constant buy, they will be prone not to buy it at your place, and that's a sale you're losing. And if they go around and tell the friend of a friend of a friend not to go to this pharmacy, then you see that's a disadvantage to you as well. So you should also be willing to take a little more time with your customer, sit them down, measure their blood pressure. If they're hypertensive, then you know obviously they can't choose certain methods of contraception. If they want a short-term process or a long-term process, then you walk them through what their options are, but don't make decisions for them as well. So you also have to earn their trust, that they know if my friend also comes and says this, you want to be like, oh, unajua hata rafiki yako ile siku alichukua hii na hii na hii. Because they need to have that confidentiality that you can't tell the information, the private information, to somebody else. Okay? So you should recommend products that are best value for customers, including the MPSC, because it's most effective. They can inject themselves at home. It has very good pros, very minimal cons as well. Yeah. Next slide. So we're going to do an activity. So we're going to do two different approaches to our business. So we're going to look at the same client with the same need in two different pharmacies. So this is an example. I encourage you all to open your chat boxes at this point, because we're going to answer. I'm looking forward to your engagement on this. Next slide. So Purity is an 18-year-old who has finished high school last year. She's not in a long-term relationship and she's not in any financial stability. She's sexually active and decides to obtain contraceptives from the pharmacy by her estate. She asks a few friends to help her gather enough money for a long-term method because she cannot afford to continue buying the morning after pill, and heads to the pharmacy. So that's part one. I hope you're on the same page. I believe this is a scenario everyone has encountered, a basic scenario. So next slide. Purity heads to the pharmacy in her estate and quietly asks the pharmacist for contraceptives. The pharmacist has two types of contraceptive methods available, one of which is the branded pill for daily use, which is the COCs, and the other, a self-injectable one, a DNPSC. She offers Purity the more expensive pills. When he tells her the price, she becomes visibly distressed. She asks him if he has anything cheaper. Knowing that she's desperate, he tells her no to make a bigger sale. Purity purchases the branded contraceptive pills and leaves. I hope you're together at that point. So will Purity return to this pharmacist? Why or why not? If her friends were in the same situation, would she recommend this business? Kindly type your answers on the chat box. I want to engage with you. I want to see if you think this is a viable, what the pharmacist did is viable or not, and if Purity would be willing to return to this pharmacy at any point or not. Thank you for typing your answers. Yes, 100%. The pharmacist was pushy. And this is why we're talking about customer relations. You shouldn't be in a bid to make a higher sale. Yes, at the end of the day, you'll have a good sale, but at the end of the day, you're losing a customer. You've lost her friends also as a customer. The second question, if her friends were in the same situation, would she recommend this business? Do you think she'd recommend this business to her friends? Yeah, no, yes. No, she will not recommend. Definitely no one would recommend because you're being pushy. This is something she'd have to buy monthly. In this case, we're looking at a monthly daily pill that she'd have to take, which is expensive. So she won't even be able to probably buy it next month when there's an option of a cheaper family planning, which is the DMPAC, that she can inject herself once and she won't have to inject herself for another 3 months. She'd literally have to buy the DMPAC probably 3 or 4 times in a year compared to buying a branded expensive pill every month. I believe we're all on the same page. I believe we're all good pharmacists. Thank you for everybody who said no. At least the public is in good hands. Thank you. So I hope I've made sense with this. She's not definitely likely to go back to the pharmacy, and she's definitely not going to recommend her friends. No matter how much a price is, or no matter what sale you'd like to make, look at the customer and try to relate with them, the fact that they'd have to come back. So you want to maintain a relationship with them and not just a transactional gain. Next slide. So Purity heads to the pharmacy in her estate and quietly asks the pharmacist for contraceptives. Just like the first pharmacist, he has both 2 types of contraceptives available, one of which is a branded pill for daily use and the other a self-injectable one. The pharmacist can tell that Purity is confused and tells her it's okay. I will tell you about both options. He tells her about both options. She chooses the self-injectable one, DMPAC. As she's paying, the pharmacist respectively mentions that in case she has any further questions, she can call the pharmacy or pass by any time. The pharmacy is open. Sophia adds a pack of paracetamol tablets to her purchase. Guys, I don't know if you're seeing the logic in this, but this is beyond amazing, honestly, because the pharmacist has sat Purity down. He has given her both options. He's explained both options. She has been able to choose on her own without being pushed. Yeah. And then she's been able to add another sale for this pharmacist, which is paracetamol tablets. And in this case, Purity is definitely likely to come back again, because when she has questions, she can be able to pass by. Paracetamol was just an extra buy. It's not linked to the DMPAC, Emma. Yeah, exactly, Patel. Of course, she'll return as she was not comforted. Exactly. She was not pushed. This is a decision she made by herself. If her friend was in the same situation, would she recommend this business? I encourage all of you to be like this second pharmacist. I know sometimes like a day passes and you've not made your target sales, but don't push a client to buy something expensive for your benefit and you're losing this customer at the end of the day. Because she'll have to go to other pharmacists who are offering her better service. And she creates a relationship. 2-3 years down the line, she'll still maintain the same pharmacy, the same pharmacist, and always buy medications from there. Her friends will always buy medications from that specific pharmacist. Yet you've lost all these clients because of one sale that you wanted to make as a big sale. Yeah. Thank you so much, guys, for answering. I really feel good that the public is in good hands, honestly. Next slide. The value of a customer. What do you think a loyal customer is worth over the course of their lifetime? Do you think a business would be better off minimizing the time spent on customers versus investing time in relationships? In this case, compared to these two situations, the first scenario, the pharmacist didn't spare his time to explain the difference between those two contraceptive methods to Purity. Over the second one, who's invested time and created a relationship with Purity, so Purity is able to come back multiple times, is able to recommend her friends multiple times to always go to this particular pharmacy. So you can see in this case, the relationship will create transactional sales over a long period of time compared to this one sale that you can create over one sale. Yeah, next slide. So these are the views for transactional and relationship. So on a transactional side, you make sales at all costs, regardless of the needs. Like a client comes, you want to sell the branded, you can sell Yasmin, which goes for about 1,200, yet there's Femi plan that goes for 80 shillings. That's a transactional view. Yet you should get to know the customer before you make the sale. Understand what they need. If they prefer something branded, then give them something branded. If they tell you they're on a budget, give them something that is within their budget. But don't force down or don't coax a client to get something expensive because you also have your own transactional target for your business. Also, the transactional is very self-interested. It's very selfish, while the relationship one is mutual. You're talking, the client is telling you X and you're replying Y, and they're telling you, I want something between X and Y range, and you're giving them that. It's mutual. You're both in agreement of what to give. Instead of just placing something on the table worth 1,200 and the client is like, hey, it's because I don't have an option, but let me just take it. It shouldn't be like that. Focus on what you get during customer. The transactional one focuses on what you get during customer interaction, while the relationship focuses on what you give during customer interaction. So in this, you're giving information, you're helping the client with knowledge on what they need. So even when, if a time comes that they want to switch to a different family planning method, then in this case, they're already mentally aware of the options, of the side effects, of the terms. Is it a short-term plan? Is it a long-term plan? They're already aware. Yeah. So in transactional, you're also winning conflicts, while in relationship, you're resolving conflicts. So transactional, you just want to win, you just want to make the big sale, you just want, at the end of the day, you say like, hey, today I sold X amount of money. While in the relationship, you're resolving, like you're actually solving a situation where you're helping the client achieve a result that when they walked in, they wanted to get answers and you gave them those answers. So transactional, like I said, obviously it's a short-term gain. You'll make that 1,200 at the end of the day, you'll go home happy. But the other, when in a relationship, the client has probably not bought that 1,200, but over time, because you've maintained them as a customer, they'll even buy more than what that 1,200 you'd have made in a day. Because then they'll keep on buying, and only from you because they trust you and because you created a relationship with them. So obviously, like in transactional as well, there's less likely any referrals you're going to get compared to the relationship. You're going to get to more referrals, because every time they meet their friend, every time somebody asks them for advice, they'll be like, hey, go to Nani's pharmacy, she'll help you. She helped me, she'll also help you. Compared to this one, where it's like, that pharmacy, don't go, it's always so expensive. So you see, you've lost customers. What goes round, nobody's coming to buy again, just because you made one mistake of selling something high priced and also not taking time with your customers to explain things to them. So I believe I've explained this well. We can go to the next slide. And Dr. Mungoma will take over from here. If you have any questions, kindly type them on the chat box. But honestly, guys, I believe the public is in great hands. Thank you so much for engaging, and thank you so much for. I really appreciate that we are all on the same view when looking at such situations. Thank you.
Thank you so much, Dr. Anita, for a very, very good presentation and interactive session there. In fact, I think people have learned quite a lot from what you've just talked to them about. So I'll quickly go through the other phase. And just as a follow-up, it's important to know your client or your customer. Think about businesses you are buying from. You need to understand how well do the owners or the staff know you, or do they just acknowledge you as any other person just that walks in and leaves money? So even if they don't know or recognize you, do they try to learn about your needs? Do they talk to you? Do they say something? Do they say hi? Do they notice anything about you? How might it benefit a business to know their customers? I think that is something that we need to really appreciate in our pharmacy businesses. And some of the benefits of this kind of relationship, one is that the clients trust you. And once they trust you, they keep coming back and they make referrals. That's good news for business. Share useful information, so that it can help them. Let them talk about pre-existing health conditions, other drugs being consumed, and tie that to other useful information. That way, clients coming into your business will remember that this is not just a place where you go and get commodities, but you get a service. And it's something that we're trying to really push in pharmacies, so that you're a service provider. You're not just a salesman, as much as we appreciate sales as being integral in maintaining a business. But it's these other components that really ensure that that takes place in a consistent manner. They feel you care about them and their families. And you'll find actually there are people who will have pharmacies where every member of the family goes and buys medicines or seeks information or gets services. You're more likely to come back and more likely to refer other friends and families. So do you know your FP service seeking clients? Name and age. I know sometimes it can be tricky to get their names, but with building trust, you can always find out who they are and who they are called, what occupation, what do they do, what are their health concerns over and above seeking FP service, family members, anything else that these clients would have, whether it is even just having other medications that they're taking, or clients who have information or even disinformation, because we live in an era where people can access all manners of things. Are there some clients you know better than others? How can you get to know your clients better? So building a rapport, active listening, which is actually a skill. Active listening, very, very important. You must also get to know clients, leave a good impression. There are people who, part of impression is also just even their presentation. As a business owner, you need to show up in a manner that really makes an impression to the client. And small positive interactions add up. They build relationships. Small positive interactions, even just mentioning to a client how they look, not necessarily how they dress, but, oh, you're looking very positive, or you look very enthusiastic today, or something like that. Small negative interactions add up, can compel customers to go elsewhere. Being friendly, give customers good impression of businesses. Greet customers, very important, because sometimes you go to pharmacies or you go to certain drug stores and you don't even get greeted. It almost feels like, okay, so what do you want? Is the look you get on their faces. Smile, put down other work, and importantly here, living in an era of technology, put down your phone or other technological gadgets so that you can actually give some attention to the client. That is so important. That interaction, that connection can really boost a business. Respect customers' privacies. Don't be too friendly or insincere. So there's a thin line there. If you're too friendly, again, clients can get suspicious. Show that you care. Pharmacy customers, especially women, but we're not being biased, can be worried, can be anxious, or can be in pain. It could be a client who has started taking a certain type of contraceptive, and they're probably having side effects that include headaches or backaches. These you can refer to some of the other webinars that we've had, or they could be embarrassed. Reproductive health, even more sensitive. So it's important, it's critical to avoid seeming judgmental, whether it's by how you look at the client or some of the words that you use. When they share the concern with you, say, it's good you came in today. I'm sorry to hear about that. I'm happy to help. Let's make sure you get the best care for your health concern. These are very simple words, but they're very powerful words because they can actually change how a client feels, one, about themselves, two, how they feel about the business, and how they feel about you, the pharmacist, providing this service and even the commodities. That element of trust has a very, very strong component when it comes to outcomes of healthcare, you know, and non-judgment, a woman's reason for buying reproductive health products, don't impact our professional obligation to provide the healthcare products she needs. Very important. So however we might feel, essential to treat her with respect and show sensitivity and be non-judgmental. Do not start judging clients based on how they're dressed up or how often they seek certain commodities. In our previous conversations, we've talked about proposing other forms of contraceptives if we feel that maybe that would be more convenient for the client. For example, if they are taking pills, or you notice that there's one particular client who probably would be taking emergency contraceptive pills at a certain frequency, it would be good just to engage this client and propose other methods so that one, in a manner, again, that is non-judgmental, to achieve a sense of, okay, over and above just taking my money as I come and buy these pills, this pharmacist is actually interested in what I'm doing, in what I'm buying, and my health. So women in this situation may be nervous, embarrassed. If she seems in a hurry, be quick, discreet, provide advice appropriately, cross-sell if opportunity presents itself, but don't attract attention, delay transaction any longer than she wants to. So this helps to, so it also helps to have private space set aside for counseling, to have these conversations. See, this again is connected to how do you want to set up your business? How is your pharmacy business? Because there are people who think having an extra space for counseling might just be an extra expense. But it's only when you start utilizing this space to provide family planning services as well as other services where privacy is appreciated, and even that just that space itself creating other business opportunities. Resolve conflicts quickly and courteously. So occasionally conflicts with clients can arise. This is very normal. People can be very upset. They buy a tablet or they buy a certain product and probably they didn't check it very well. And they go home and find that, well, it's not very easy to comprehend or they actually didn't follow any instructions while you're talking to them or explaining to them, and they come back and say, well, you told me that I need to start this tablet at this point, but when I go home, there's a lot of writing on this strip, and I think there's something wrong with this pharmacy, and you can get into a point where conflict can arise. So first, acknowledge the customer's feelings. Say, that sounds disturbing. That could be something that you could adopt. Say, I understand, that is very upsetting. This can diffuse conflict instantly. Just an acknowledgement, or just saying, let me look at it. Oh, what really happened? Next, let the client vent. Listen actively. So actively means over and above having eye contact, nodding if necessary, and just being in a situation where you're connected to what she is saying or he is saying. Don't interrupt. Don't get defensive. It's natural for human beings to become defensive, especially if they feel that maybe this is going to be a threat to the business. But actually, if you listen to this client actively, it's not a threat. This client will come out with an impression and say that, you know what, we can actually trust these pharmacists because they listen to us. They're able to acknowledge their mistakes, correct, and guide. Lastly, respond appropriately. Take responsibility if something went wrong. Use positive language to clarify misunderstandings. So as regards women's self-care products, some of the examples include injectable birth controls, and the DMPA-SC, as illustrated there, is one of them. But we also have the intramuscular one. Contraceptive pills, pregnancy tests. So not only women's products include STI testing or screening, so that it's not just the act of testing, but it's providing a service including counseling, and in other cases, referrals. So treatment, malaria testing and treatment, blood sugar testing, and also insulin injections. So over and above provision of these family planning services, we're expected to develop these skills because self-care is something that is being embraced by a lot of clients out there. So you need to be equipped. You need to be equipped to provide these self-care products. So self-care is an emerging market. More and more women are seeking these self-care products. So self-care is a growing market. One, it provides convenience. It's quite practical. Easier to plan around. It's reliable, cost-effective. You don't have to spend on transport to go to certain facilities. You don't have to spend so much time because time is also has a cost implication to it. You don't have to queue. You just have to plan around your local pharmacy if they're reliable, if they have convenient times in the evenings, or some pharmacies also have a 24-hour service or even an online service because life is changing. More privacy around delicate health concerns, especially contraception. And then there's more control over one's own health and family planning. This also empowers women. So giving a focus on DMPA-SC in community pharmacies, which PSK has really fronted in terms of training, as well as ensuring that people are able to understand and appreciate the ability of DMPA-SC to provide quality family planning to women who are able to be trained and provide self-care. There are studies out there that have positive outcomes to DMPA-SC in community pharmacies. This particular study that was published in 2016, takes note of the fact that provision of injectable contraceptive from a pharmacist might make this method attractive to almost 1 in 3 women who are not currently using it. This could be a strategy to improve uptake and continuation of this method. This other one in 2017 says in part that delivery of the subcutaneous contraceptive injectable from a community pharmacy may be feasible, but availability of sufficient numbers of pharmacists trained in this technique is necessary for a robust model of service delivery. I know we are still at a point where we are organizing ourselves as PSK to provide more training, but I think we're getting there, and very soon we'll be communicating the same. So again, these are the study that says administration of DMPA-SC by pharmacists in a pharmacy setting is feasible. Continuation rates and patient satisfaction with DMPA-SC and the pharmacy setting were comparable to those who received DMPA-SC in a family planning clinic. That's how important community pharmacies are. That's how solid community pharmacies are in providing these services. They are trusted, they are reliable, they are convenient, they are accessible. And as was mentioned earlier, part of this project is to ensure that there is increased access to quality family planning services, as well as commodities in community pharmacies. Now, before I finish, I just wanted to mention the total market approach, that is TMA, and I won't get into the details of it, but it's important just to provide a definition because this is something that is coming up, and it's important that pharmacists are prepared for this. So TMA defined as a coordinated means of serving all clients in a country, from those requiring free services to those willing and able to pay, to maximize access, equity, and sustainability. It seeks to maximize market efficiency, equity, and sustainability through the coordination of the public, social, marketing, and commercial sectors. So a total market approach to family planning aims to efficiently use all available public, non-profit, and private commercial sector resources and infrastructure to improve access to family planning products and services for all clients. So you're in the right space if you have a community pharmacy for TMA. So ultimately, a total market approach to family planning will grow the market in a sustainable manner, ensuring that those in need of family planning can access it through varied and optimal channels. So I'll leave you there with this saying from the Mijikenda tribe. I won't try to say it in Mijikenda, but it says, run past an old man all you want, but you won't beat his wisdom. Thank you, everybody. And I'll take it back to Hezron to guide us on the next steps. Thank you.
All right. Thank you so much, Dr. Mike Mungoma and Dr. Anita Ochieng for the very insightful presentation on customer relationships. So at this point, I'd like to invite Dr. Georgina Kamene from Kasha.
Hi, everyone. You can hear me?
Yes, we can hear you loud and clear.
Okay,
let me
great.
just put up your presentation.
Okay. Thank you. Hi, everyone. I hope everyone is okay. My name is Dr. Georgina Kameni, a pharmacist at Kasha. Kasha is Africa's leading platform for access to health. At Kasha, we are big on family planning, self-care, and sexual health. So I'll be talking about what we do at Kasha. At Kasha, we do a lot of customer, patient, and market insights. We leverage on Kasha's experience and insights into the market and customer to evaluate and test positioning of our products, and also Kasha as a brand, and also develop customer and patient-centered access to health strategies. We also do a lot of demand generation and behavior change. We increase demand to access to adherence to health products and services by engaging our customers and patients through our Kasha agent network. We have over 200 agents in different parts of Kenya. And we also do that through health information tools and services, which I'll be talking about in the next slide. And we also do last mile delivery. We ensure that we reach our customers and patients with health products and services through Kasha digital platform, where we have different digital tools, and also we have an e-commerce platform, and also through our reliable and sustainable distribution system, which currently we are using geo mapping and also utilizing our agents in different parts of Kenya. And we also do visibility and analytics, optimizing on route to market, targeting certain markets, product performance and services delivery through real-time visibility, and also conducting analytics on our Kasha platform. Next slide. Like I mentioned, on Kasha, at Kasha, we are very big on family planning, and we offer our family planning services and products through various channels. And one of those channels, we have a live nurse chat where you can chat to a nurse on any questions or any information you need on family planning. And you also have a toll-free number to the pharmacy where you can call the pharmacy about any information you need about family planning. And also partner with health facilities where we refer our customers that come looking for long-term methods of family planning. And also we do a lot of offline health education sessions. We do a lot of blogs. We do social media posts about family planning methods and any information around family planning. And we also support medical camps where we support on provision of various medical family planning services. At Kasha, the pharmacists and the nurses have been able to go through the PSK training on offering family planning offerings by medical providers. And also we distribute IEC materials through the orders that we distribute to our customers, which are either WHO or MOH approved. And also on our platform, we have a website, kasha.co.ke. We have various digital health tools where you can either chat to our nurse. We have a toll-free number that you can call either to customer care, to the pharmacy, or to the nurse. And also we have a contraceptive tool where when you click on it, you can either learn or read about various family planning methods. And then also there's a questionnaire that you can, the customer can fill. And then the questionnaire will narrow down to a more suitable family planning method for the customer. And then the customer will also be able to talk to a nurse through the same tool, and now maybe discuss about their family planning, or if they have another option, or they need more information on any family planning method. And also, in addition to the information that we offer our customers, we stock a wide variety of family planning products, which I'll talk about in the next slide. So also at Kasha, we operate a retail pharmacy and a wholesale pharmacy. Our retail pharmacy is an e-pharmacy that services our direct consumers. And then we have a wholesale pharmacy that services our bulk customers, like the other retailers, the wholesalers. And in both pharmacies, we have a wide variety of products, ranging from sexual health products, contraceptives, and because we also are are big on self-care products. We offer a lot of menstrual care products, which I'll show in the next slide. So at Kasha, we stock a wide variety of contraceptives, running from the self-injectable, the COCs, the progestin-only pills. We also stock the e-pills, condoms, the patch, which Dr. Mugoma has mentioned is part of self-care. And at Kasha, we measure into family planning, self-care, sexual health. And we also stock a quite variety of self-test kits, running from HIV, pregnancy, ovulation, COVID, and malaria, which we stock both in our retail and wholesale pharmacy. This slide is more on self-care because we get a lot of, most of our customers are women. So we get a lot of clients coming to us about having questions around menstrual care or self-care. So this slide shows some of the products that we stock under the self-care category. We have menstrual cups, we have reusable sanitary towels, and also reusable sanitary pants, which really do well because if you look at it, is economically, the reusable sanitary towels and the panties makes more sense. And also we have tampons, we have panty liners, and also we have like the common sanitary pads. So plus the products that we offer on self-care, we do a lot of blogs, we do a lot of media, social media posts, talking to women about their menstrual care, about mostly they ask about missed periods, painful periods, or delayed periods. The next slide. So this slide is, if you need to know more about Kasha, you can reach us through the email or call or WhatsApp the pharmacy. The last one. Thank you so much.
All right, thank you so much, Dr. Georgina Kamene. Now we're just going to move on to another Menti session that is going to be run by Dr. Johnson Anyona, just to gauge how you've been able to gather the information in this session. So Dr. Anyona, welcome.
Thank you very much, Hezron. Thank you to Dr. Anita, Dr. Mungoma, and also Dr. Georgina for the excellent session on how we can build customer relationships in our retail pharmacies. So we are once more going to do now a post test to assess knowledge acquisition. So you'll again once more go to menti.com. You should be able to see the code at the top of the screen. Enter the code and you'll be able to see a love button at the bottom. So you hit that love button so that we can register your attendance. Let's do it quickly, please. I hope my former branch, South Nyanza, is in the house. Shout out to South Nyanza branch. Okay, let's go through the Menti. I hope everyone is in. We are doing this on menti.com. The code is at the top. Once you are in, you'll be able to respond to the questions. Here's your chance to correct any wrong answers you did at the beginning. So question 1, What might make a client prefer one pharmacy over another? We were able to see this in the discussion Anita took us through. What are some reasons why, as a client, one might choose one pharmacy over another? Okay, let's see some of the responses coming in. So customer service, quality of care, ambience, and professional services. Okay. Proper service delivery to the patient, trust and confidentiality, price, accessibility. Yeah. You tend to go to the neighborhood chemist for immediate service. The cost of medicine, rudeness, price, poor attitude, lack of knowledge, incompetence, knowledgeability of the pharmacist, wide range of drugs, good communication, quality of care, which is our theme today, cleanliness. Excellent, excellent responses. Better services. Thank you very much for your responses. Keep them coming. Let's go to the next question. The following are potential benefits to a pharmacist of establishing relationships with clients, except the following are benefits to a pharmacist of establishing relationships with clients, except yes, indeed, we can see discounts and offers. Yes, it is a benefit, but it is not a benefit to the pharmacist, it's a benefit to the client. So that was the correct answer. Next question is, which of the following is not a tactic to building rapport with customers? Which one is not a tactic to building rapport with customers? And we saw this in Dr. Mungoma's session. Yes, the correct answer is being aggressive. Yeah, you can see that being aggressive is not really a good tactic to building rapport with customers. So some of the tactics we were taken through are you need to be friendly, have something in common, show that you care, etc. Okay. Now, on the issue of self-care, the following are examples of self-care products for women, except, and you've seen this in Kasha's session as well as Dr. Mungoma's session. Which one is not a self-care product in this list? Let's see the answer. So DMPAIM is not a self-care product. Depot, popularly known as Depot, requires a healthcare provider to administer it. So you have to go to a facility to get a nurse, a pharmacist, or a healthcare provider to administer the method to you. Remember, it's administered intramuscularly on the deltoid or gluteal muscle. So you need somebody to administer. But the other products, DMPAC, test kit, emergency pill, the client themselves can be able to consume them without the help of a healthcare provider. Thank you very much for taking part in this pre and post test. I hope the session was helpful and the questions were able to jog your memory and reinforce the knowledge acquired. Back to you, Hezron. Thank you.
All right, thank you so much, Dr. Johnson. So members, we're now going to move into the Q&A session. And I'll just start by asking the first questions that we've received here. And the first question goes to Dr. Anita, who asks, what services do you suggest a pharmacist can offer alongside FP? For example, health screening, tests to intervene, for example, PT, before giving contraception? And can a pharmacist charge for these services without scaring the customers? So I believe Dr. Mike and also Dr. Anita, you could respond to this.
Yes. So what I suggested, what I'm currently practicing is creating a package. So I have a package where I charge 1,500, and then this package includes the test, includes the family planning I'm going to give you, includes high blood pressure. It includes also the consultation. So depending also on the contraceptive method the client is going to take, because I can't charge family planning that's costing 80 shillings, the same price to what I'd price DMP SC or DMP IM for. So then you can put it at a fair rate of maybe 1,000, but obviously these tests need to be charged. So depending on your logistics of a pharmacy and on how you want to attract your customers, you can either decide to charge it, because I mean, a pregnancy test, the Aerovita ones cost 100 shillings, and assuming they take family planning, so that's a total of 180 shillings. So maybe you can put the charge at like 200 for, or 250 inclusive of consultation, depending. So you can weigh your logistics according to your market and where you're based and your clientele. I believe that helps and that answers the question. If not, just type in your question again. Yeah.
Dr. Michael, I don't know if you have any feedback on that.
Yes, I think Dr. Anita has said it very well. As a business owner, you need to understand your environment. You need to understand your clients. And again, you need to also understand what level of service do you want to provide and your business setup. All those will dictate how much you're going to charge. So my own experience of those that we have trained, we have people charging from 150 shillings to those charging 2,000 shillings. So I think there's no fixed price for these services. It depends also to the extent to which you're engaging your client. You know, if you have a client who wants short-term or long-term contraception and they're having other medication or pre-existing conditions, I would imagine again that if they're taking medicines for the other conditions, we introduce an element of MTM, you know, medication therapy management, which should also be charged because it's a very important service. So let's all look at this as a business opportunity and see how it fits in our business setting. Thank you.
Okay, thank you so much for that response. So we have another question from Dr. Obala Neto. And first it says, nice discussions on customer care indeed. And the question is, with an African mentality where empathy may mean otherwise to clients like extreme discounts and free services, how do you handle clients who may want to take advantage of these soft spots?
Yeah, maybe just to quickly respond to that. In my previous webinars, I've talked about 3 very, very important factors that we consider in our setting: culture, religion, and tradition that influence health. And these can be very strong. They can come out very, very strongly. As a health service provider, you need to be aware and be very non-judgmental. You need to have a very open mind when you're interacting with your clients as regards to family planning services. It can be a sensitive issue. It can be an embarrassing issue. It can be a private issue, or you could actually have clients who are very open about it, that they can actually intimidate you as the pharmacist. So you need to be aware, open up your mind, get knowledgeable about these products and services so that you can better engage your clients. I think that would be the most appropriate answer to that question. We don't want to Africanize the whole issue. Thank you.
All right, thank you for that. We have another question here. I'll just tie in the two questions that have been asked. Can DMPA-SC available in community pharmacies be advertised to improve uptake? And the other question is, should the right term be customers or rather clients? So maybe you could respond to the two. Dr. Michael or anyone in the panel.
Can we ask Dr. Nyona to respond to that?
Sure, thank you. So, yeah, the solution for this can be demand generation. And so we know that the board has prohibitions on advertising specific brands. So, however, to raise that uptake of DMPA-SC, there are various interventions for demand generation that can be deployed. So both physical and online. For example, we've had quite a number of campaigns on social media just to raise awareness amongst that cohort who access social media. There can also be outreaches done in the community or neighborhood. We've seen pharmacies who are using community health volunteers. But in family planning specifically, you have to talk about the whole method mix so that you're not biasing clients to one method, because we know that not everyone is really eligible for every method. So you have to raise awareness on family planning in general. And of course, since it's a relatively new method, you can give emphasis on this new product, DMPA-SC, using some of the strategies I've mentioned. Thank you.
Right, thank you so much. Another question here is on where can one get training on FP? And this is a question that I've also gotten on my inbox. Guys are asking where can they learn this. Maybe Dr. Michael, you can guide on that, because I know you're the chair of the education committee for PSK, and we've been doing some of these sessions before.
Yes, so education is a continuous process. As you're aware, we're having series of webinars on FP services, FP commodities. So that is a continuous process. However, we have an MOH approved curriculum to train pharmacists and pharmaceutical technologists to provide these services, including injectable contraceptives. I said earlier, we are still finalizing certain logistics. I know there's a bit of a delay in organizing for training for the next cohort. We are hopeful that this will happen before the middle of the year, but I think let's just be patient on that. I know that there are a lot of people who are really interested. However, we can only say that we'll update you as and when. Thank you.
All right, thank you so much for that. I hope your question has been answered. We have a question from Dr. Faith, who is asking, is there a screening tool, for example, one that is used for prep assessment that one can use tailor the required questions that you can ask a client? Is there a tool that has been created for assessment?
Okay, maybe just to mention, we have MEC wheel, which MEC is MEC, Medical Eligibility Criteria. So this is a tool that has been developed that can guide the provider to provide, the best information to the client. It can also provide a very useful channel for assessment, especially if there are clients who are having pre-existing conditions or taking other medications to determine the best method. So that is one tool that can be used. However, there are very many resources out there, and you can also liaise with PSK so that we can share some of these online resources. Thank you.
All right, thank you so much. There's a question from Dr. Purity, who's asking, how much is the menstrual cup? That is, I guess that's a question to Dr. Georgina.
Yes, for the menstrual cups, we have some that go for 4,000 and others that go for 2,500 and others for 3,500.
All right, thank you for your response. So I'm seeing we are running out of time. Yes, Doc?
I think there was an important question there that was asked, but I can't remember the name, but somebody was asking about disposal of sharps and needles and DMPA SC. That's a very important question. We have tackled it in previous webinars, but just to mention here again, that clients who are eligible for DMPA SC, part of the training for them to use this and use this at home includes how they dispose. So they're expected to either buy or get or use a puncture-proof container at home to dispose of the sharps and the DMPA SC. If they have latrines as part of their where they stay, these can be disposed in the latrine. However, they are also strongly advised to liaise with the pharmacy where they are getting their commodities and services to be able to return the sharps for further disposal by the pharmacy. So that's a very important point that we needed to pass across. Thank you.
All right, thank you so much for that response. So we'll just take, I think, 2 more questions, then we'll close. So there's someone who's asking, how can the charges you mentioned, this is to Dr. Anita, how can the charges you mentioned be standardized to boost confidence from patients and for purposes of replication? So maybe Dr. Anita, I think she's, we've lost her from the meeting. Dr. Mike, I don't know if you'll be able to give feedback on that.
Yes, I think that question has already been answered. We cannot standardize the charges or the costs. Like I said, you have to look at your market, you have to look at your client, you also have to look at the service that you're providing, and just make a determination that is going to be useful for your business. Remember, again, from a business perspective, this has to be profitable, but it also has to be sustainable while providing quality services.
All right, thank you so much. One last one. This is by Dr. Elsie, who's asking, how do we link registered pharmacies to clinics for further assessment to avoid adverse effects or pregnancies while using FP? Where does pharmacies report the data on FP uptake, and probably like to the MOH monthly or periodically?
Yes, I think now we're getting to the training bit of providing these services. But let me just say that having a referral system is integral to providing quality family planning services. As a pharmacist or a healthcare provider, it is important to know who is around you and who provides what additional services that you may need to refer your clients. If there are clinics around you, if there are hospitals around you, it's important not just to know the location or even the name of the premise, but it's important just to even pay a visit, know someone there, know a nurse, know a medical doctor, know a clinical officer who you can refer clients to. Remember, not all family planning services can be and commodities can be provided by the pharmacy, but having the knowledge can really improve the outcomes to the client, and the referral system is one of those key components.
All right,
Yeah.
thank you so much.
As regards reporting, I think we need to tackle that in a training. Yeah.
All right, thank you so much. So at this point, I'd like to just ask our panelists to give just 1 minute parting shot before we go into closing the session. So I think I'd start with maybe Dr. Michael Mungoma, then we'll have Dr. Wanjiru, then Dr. Georgina, then Dr. Johnson. So welcome, Dr. Mike.
Thank you very much, Hezron, for facilitating this. I think you've done an excellent job. And I also want to thank inSupply for supporting this and being part of this project. This will go a long way in ensuring that our pharmacists are well equipped, and we look forward to further discussions as well as feedback and sharing by pharmacists who have been empowered by these webinars.
All right, thank you. Dr. Wanjiru.
Hi, I think for me, it's just to give thanks for all the very active engagement by all the participants, but also to thank the facilitators for these webinars, for making it very interactive and very practical. I think we must admit that all of us learned something new, and hopefully we can also disseminate to our colleagues and share this with our colleagues. Thank you and good night.
Thank you, Dr. Georgina.
Hello, mine will be to say thank you to PSK and inSupply for inviting us to this webinar, and also to let everyone know that family planning is something that the pharmacists can do a lot by offering either the services or even the products, and to say good night to everyone.
Thank you. For me, I'd just like to appreciate all the panelists for the excellent presentations, discussions, and all the attendees for the great questions, great engaging, very useful insights shared across. And as we are now making this shift to optimizing the pharmacy channel to offer quality advanced family planning, let's really take advantage of all the fora available, not just physical trainings, but also these webinars as an opportunity to upskill ourselves so that we can be able to take this space in our pharmacies. Have a good night, everyone. Thank you.
All right,
Yeah.
thank you so much, Dr. Johnson.
Yeah, Dr. Hezron, just before we conclude, I think it's important to remind all the PSK members that we are having our annual Pharmaceutical Society of Kenya conference. This is taking place between the 22nd and 27th May this year at Diani Reef Hotel. And yes, it's good you've displayed that. And we're really encouraging everybody to register and participate, because I think it's going to be really exciting. There is quite a lot that has been planned for this conference. And please contact the officers or write your inquiries by emails to the email addresses that have been displayed. Back to you, Hezron.
All right, thank you so much, Dr. Mike, for taking us through that. We also have a couple of things to share here. Just on your chart, you'll see there's the LinkedIn page and Twitter for inSupply Health. For those who would like to know more about them, please just follow them on the social media handles that has been shared on the chart. And also another thing to note is tomorrow we'll be having another webinar by Abbott, and it's going to be on management of diarrhea in pediatrics. And it's going to be happening at the same time at 7 p.m. On Thursday, we'll have another session by Helion, which is on a new look at paracetamol. That will be happening at the same time at 7 p.m. And on Friday, we'll be having, this will be a branch session. For those who belong to the Lower Eastern branch, there will be a webinar that will be on the role of pharmacists in management of hypertension that will be happening at Galian Hotel. So please take note of that and attend those events. Yeah, so I think from my end, it's also a thank you to all the panelists who've shared their insights today, and also for the attendees up to a number of 600. Thank you so much for joining and staying with us till right now. And this is where we close. My name is Hezron Munyakin. I was your moderator for today. Thank you so much, and see you tomorrow for the next session. Have a good night.
Right.